Cook County has received $1 billion from the federal American Rescue Plan Act. Today, Cook County Board President Toni Preckwinkle released details on what that money will pay for. President Preckwinkle says $320 million will be allocated for this year. $60 million will go to violence prevention and reduction programs. Another $60 million will go to health and wellness programs, and $100 million for economic and community development initiatives. And Cook County Board President Toni Preckwinkle joins us now. Madam President, thank you for fitting us in again. Before we get to what we just discussed, first, what is your reaction to this news about the former House Speaker?
Well, I issued a statement just a little bit ago calling for Mike Madigan's resignation as committee person of the 13th Ward. And he's been charged with using his office for personal gain, bribery, and racketeering. And although those matters will be adjudicated at some point, I think it's best for him and surely best for the party that he pursue his defense, not as a committee person.
What is your reaction, as yet, another Illinois official is facing, more corruption charges?
I'm a history teacher, and I always say, in a democracy, you may not get the government you deserve, but you will surely get the government you put up with. And unfortunately, here in Illinois, we've had a pretty remarkable tolerance for bad behavior. And this is yet another example. And I'm encouraged, frankly, that finally there's some accountability, and I hope that justice will be served.
So, of course, moving on to Cook County and the federal funds, as we mentioned, $60 million for 2022 on different violence prevention and reduction programs. Today, you spoke at the City Club and you emphasized that the community can't police its way out of its violence problem. How is the county collaborating with the city and Chicago Police Department on this?
Well, first of all, I should say there's an intergovernmental working group that includes the state and the county and the city. And we're trying to both make the best use of the resources that we have and not overlap our investments. So there's an intergovernmental working group that's working, frankly, to try to be sure that we make the best possible investments in violence prevention. And I'm grateful for our state and city partners in that work. We have been focused since 2013 in my administration on trying to support community-based organizations that are doing violence prevention, anti-recidivism, and restorative justice work. And, I'm proud of that fact.
What are some of the violence prevention strategies that you plan to invest those $60 million in?
Well, we've invested for some time in street intervention work. The brave people who are out in our communities trying to damp down the violence. We also support community-based organizations that work with those who are coming out of our jails and prisons. We work with and support organizations that are working with young people who have been involved in the criminal justice system. So there are a variety of initiatives that we have, as I said, been supporting since 2013 and are now working in conjunction with the state and the city to ensure that we make the best possible investments.
Another $16 million this year going to behavioral health and wellness. How will that funding support the people who've been impacted by gun violence and trauma?
Well, as we talk to our commissioners about their suggestions for how we might spend our ARPA dollars, I think each and every one of them said that we needed to invest more in behavioral health. And Cook County, not to our credit, has not over time really put significant investments in behavioral health, and it's long past the moment when we should be doing that. We're going to create a behavioral health services department, and in the interim, we're going to try to support behavioral health services in our clinics, our hospitals and clinics, and the Housing Authority of Cook County is going to have a behavioral health staff person at each and every one of its properties, its affordable housing developments. So, we're trying to kind of do some work as a bridge as we put together this behavioral health services department in the Department of Public Health.
Now, you mentioned full-time behavioral health services at all Housing Authority of Cook County properties. How unique is that program?
I can't speak to what's being done elsewhere in the country, but, I'm grateful to Rich Minacchio, who's Executive Director of the Housing Authority of Cook County, and his staff for his cooperation with us as we try to address these challenges.
So you also talked about abolishing $1 billion in medical debt for residents at the cost of just $12 million. First, explain for us how that works, how you're doing that.
Well, if you're unable to pay your medical bills, sometimes the hospitals will sell those bills to debt collectors at pennies on the dollar. And so what we would do is kind of intervene in that process and buy medical debt and free our Cook County residents of the obligations then to pay those debts. You know, for many people, the significant financial challenge they face in their lives is paying their medical bills. Even people who have insurance may not have the kind of catastrophic coverage that they need should their family endure some terrible accident or illness. And as a result, medical debt is the principal cause of bankruptcy in this country. So we're doing our best to try to address what we know is a real challenge for working people, for working families, and particularly for people of color in this country.
Now, you also announced another $42 million for guaranteed income pilot, expected to become permanent, expected to be the biggest in the nation. How will that work?
Well, we used some of our CARES Act money in 2020 to provide $600 stipends to families in need, and we were able to involve 14,000 families in that program. And you know, people use the money to pay their utilities, to pay their rent, to pay back to school expenses for their kids. And we're going to expand that guaranteed income initiative with our American Rescue Plan Act dollars and spend considerably more money. I think we spent $8 million in CARES Act money on our guaranteed income pilot. And we now have, I think, $42 million set aside for the pilot that will be funded through American Rescue Plan resources. And what we're going to do is figure out how we can make this sustainable over the long term so that when the American Rescue Plan dollars are exhausted, we'll still have a program in place.
In your speech today, you referenced that, the guaranteed basic income, it is not a new idea, that Martin Luther King even advocated for it some 60 years ago. Why do you think it is becoming a mainstream concept now?
Well, it's not an unreasonable idea, right? People who are poor need money. So if you give them money, you will help them address the challenges in their lives. And, Martin Luther King spoke to this in his lifetime in the 1950s and 60s. And since then, it's moved more into the mainstream. And I'm grateful for that. And we're going to, as I said, we're going to pursue this pilot, and hopefully it will also be pursued elsewhere in the country.
Now, these are among about 80 plus initiatives that you in the county plan in the next few years. Briefly give us a sense of what some of those other initiatives include.
Well, we've clearly got some issues around water infrastructure in Cook County, around lead pipe replacement. We've got environment and sustainability challenges. So there are a lot of ways in which we'll be using these resources and making investments. But the principal ones I addressed earlier, around violence prevention, behavioral health services, guaranteed income, and the medical debt pilot.
Okay, and in about 20 seconds, and you said that you acknowledge that these plans are ambitious. What challenges can you anticipate?
Well, first of all, we're going to have to staff up. We've got $1 billion in extra resources, and we need people to help us put the programs together and to monitor those programs. So we've got some work initially to do in terms of being sure that we have the talent and expertise on board to move forward. And then, of course, we will be presenting RFPs to the community and asking for community-based responses. And hopefully we'll get lots of folks who are interested in working with us to ensure that we make the best possible use of these federal dollars.
Okay, a lot of work ahead for Cook County. Madam President, thank you so much for joining us.
Thank you for inviting me.